Well, aloha and good morning. Thank you for joining us. I'm Sherry Minor McNamara with the Chamber of Commerce, Hawaii. You're here this morning because it's a much talked about subject matter and a critically important one. For the past several months, the Chamber and chambers across the state, other organizations such as the Hawaii Restaurant Association, Retail Merchants Hawaii, and our local businesses have been focusing on recovery efforts to foster a resilient and safe economic climate. And efforts to increase the vaccination has been a focal point. That is why today's webinar is so relevant and timely as Hawaii's COVID-19 counts and hospitalization increase exponentially and private businesses weigh whether to mandate vaccinations in the workplace as well as testing. While the Chamber does not have an official position at this time, we know that this issue is important. So last week, we launched a business survey to get a snapshot on what employers were thinking and planning, given recent announcements of vaccination rates. The survey found out that 266 business respondents, a majority or about 57%, were planning to mandate vaccination for employees, with many businesses operating under 100 employees and with more than under 10. Understanding and evaluating the workplace planning and safety should be top of mind. The survey also provided insights into a number of reasons why businesses were hesitant or contemplating mandates. A few concerns include not knowing how to implement properly, taking a wait and see approach, possibly losing good workers, or being exposed to legal issues. The range of questions raised by businesses and the urgency of this matter led us to putting together this webinar. I would like to thank our speakers for making the time this morning, especially at the very last minute as we put this webinar together to share their input on this important topic. So please let me introduce our three guests. First, Ray Vara, President and CEO of Hawaii Pacific Health, Jeff Harris and John Knorek, both directors with the law firm Torkildson, Katz, Hetherington, Harris, and Knorek. We will first hear from Ray on how and why Hawaii Pacific Health became among the first businesses to implement a vaccine mandate for their employees, and he'll also provide an update on the local hospital capacity. Then we will hear from Jeff and John, directors with the firm, on the legality and feasibility of mandating vaccines in the workplace. So let's get started. Ray serves as president and CEO of the Hawaii Pacific Health, and his responsibilities include executive oversight of the Stroud Medical Center, Kapiolani Medical Center for Women and Children, Palimomi Medical Center, and Wilcox Medical Center on Kauai. Ray joined HPH in 2002 as executive vice president and CEO of operations, and assumed the role of president and CEO in 2013. Ray has been in the forefront for the past year and a half on the COVID challenges and has been a tremendous resource. And we just wanted to thank Ray for his time and commitment, not only today, but for the year and a half that you dedicated to ensure that we could promote a safe space, as well as address any community concerns and address the health capacity here in Hawaii. So Ray, it's all yours.
Great, thanks, Sherry. I appreciate you giving me the opportunity to share some thoughts, and thanks for your leadership in leading the business community as we navigate what are unprecedented times throughout our community. And so thanks for all your efforts and the efforts of your team. So I really want to cover three things, and it's not exactly what you asked me to talk about, but I'll certainly hit on those points. I'm going to share a little bit about the virus itself and what we know today about the virus. I'm going to share a little bit about hospital capacity and what we're currently facing. And then I'll talk a little bit about our decision to require our employees to either be vaccinated or go through a improved testing protocol. And so first of all, some things that we know about the virus. First, with this Delta variant, we know that it's much more contagious than what we were experiencing in the early days of COVID-19, early 2020 and throughout the course of most of last year. We've also found that with this current variant, and for a number of reasons, most of which being how we vaccinated the population, that it's impacting a younger segment of our community. And the good news side of that is that they tend to be less symptomatic and require less hospitalization type of care. Now, the offset to that is we're seeing volumes of positive cases that we couldn't have imagined at this time last year. And so it's a give and take on that. We've also learned that this variant has the ability to break through the vaccine. While it's still a very small percentage of breakthrough cases, it is possible, and it's something that we all need to be mindful of as we navigate throughout the community. But I think the point that I want to make most importantly is that as we face what we're currently experiencing with this surge, the best line of defense is a vaccine. I mean, I know there's lots of opinions on this, but I can tell you that just in the most simplest way, as it relates to containing the spread of this virus, vaccine is good, no vaccine is bad. It's that simple. We know that it prevents not only in some cases the spread of the virus, but it certainly mitigates the symptomatic appearance of the virus in those who are vaccinated differently than those who are unvaccinated. The far majority of the people who are hospitalized today are the unvaccinated. This is truly a pandemic of the unvaccinated. Okay. Now, the other thing to know about the current virus is it's more. We have a more complex challenge as we deal with this from a policy issue and a management issue than we had even just a year ago. And the reason is because the denominator changed. Right now, between those who have been vaccinated and those who have been either had the virus and have some level of immunity, it changes the risk profile for our community. And so it changes the ability for policymakers to make certain restrictions and how they respond to it. You know, frankly, last year while I know it was difficult, the decisions were much simpler. There was no vaccine alternative. The entire population was at risk for getting the vaccination. And so bringing, the biggest tools to that situation that we had in our toolkit was frankly a much easier decision than it is today. So our policymakers have a complex challenge as they think about how to deal with this pandemic that is mostly impacting the vaccinated or the unvaccinated versus the vaccinated. And I would just also share, certainly in Hawaii Pacific Health, and I believe our colleagues around the healthcare system on a statewide basis are continuing to ramp up our efforts to get people vaccinated, making sites available, and the same is true with testing. And so there's ample opportunity for people to get vaccinated, which again is the best and first line of defense against the spread of the virus throughout our community. So that's a little bit about the virus itself. Next, as we think about the hospital capacity, there's no other way to say it except, look, the system of care here in Hawaii is very stressed right now. Almost every bed, if not every bed, is full. And most of our emergency rooms have some people waiting to have access to a bed that currently isn't available. And so they're waiting in our emergency rooms, they're waiting in other places for those beds to become available. The main issue today is not like we were concerned with a year ago, where we're worried about, are we going to have enough ventilators and those types of things. It's really about, do we have enough staffed ICU beds in order to care for the population? Now, I also have to highlight, it's not just because of COVID. The fact is we've got a lot of people in the hospital, even prior to this current surge, from other medical issues, whether they're heart issues, stroke issues, trauma issues that are related to deferred care, because people have been very selective about when and how they take care of their health during the course of this pandemic. And so the hospitals were already busy before we've seen this surge. So when you look at the ICU capacity, certainly it's being stretched by the COVID patients. It's not exclusively because of the COVID patients. I would say if you look at from an expansion standpoint, we're still at a place to where if we needed more ventilators and things, we have those available. So, I have to tell you, within Hawaii Pacific Health, and as I look around the entire ecosystem of healthcare, I couldn't be more proud of the work that our staff and the staff at the other facilities are doing, because we know they're tired, we know they're stretched, they know they're giving it everything they have to care for the population without having to curtail services and make decisions that differentiate between the vaccinated and the unvaccinated. And so from an ecosystem standpoint, as a system of care, what the community needs to know is we're all working very closely together. We're all working alongside and making sure that we're transferring patients if we need to transfer. We're proactively making sure that we're looking at what cases need to happen when, and we're working together to reassure the community that we got this. While this is a difficult time, the fact is this is what inspired most of us to come into this profession, is to be able to care for this community in its time of greatest need. And that's in fact what is happening. And while we don't know exactly the course that this is going to follow, whether it's going to follow, the UK model, which would suggest in the not too distant future, we'll see a plateau followed by a decline in cases, or whether it's going to follow the exponential curve that it's been on for the last few weeks. We don't have a crystal ball around that. But we do know that relief is beginning to show up in terms of providing some support for our staff, which is stretched. And then that's in the form of agency nurses that have been contracted and paid for by FEMA. We saw some just early last week, or the latter part of last week, show up in Hilo. We're expecting about 240 nurses to land on Oahu, and respiratory therapists this weekend to help ease some of that burden, and the following weekend about an equal number. So we're going to be bringing in the next week to 10 days as many as 500 more nurses and therapists and so forth to help relieve some of that burden and staff beds that otherwise right now could not be occupied. And so again, these are very trying times, and our people working very hard, but this is what we were called to do. This is what we signed up for. We went in this profession, and we will work together to get through this as a community. So the last thing I want to talk about is our employee vaccine policy. As you know, we came out very early requiring our employees to either be vaccinated or enter into a defined testing protocol by October 1st. And the reason for that is simple. If you think about the mission that we serve and the work that we're doing, it's paramount that we take every step as an organization to keep our patients, our employees, their families, and all of those around us who entrust us with their care safe during this time. And as I said, the best and first line of defense is a vaccine. And so we believe everybody in this community who doesn't have a justified exemption for either religious or medical reasons should be vaccinated. And so we've put together a program where that is a requirement that you're either vaccinated or you submit to adhere to a testing protocol beginning October 1st, of which we will pay for that testing for the time being. But the fact is that that's going to be an evolving process, because things with the life of the virus will change, as well as so will policy things change, such as when the FDA approves this on a permanent basis versus the emergency conditional use permission that we have now. And so we believe it's the right policy, and frankly, we believe it's the right policy on a statewide basis for as many folks who can reasonably put such policies in place. And so I look forward to questions after we get through the panel, and I'll stop there. And thanks again for the opportunity.
Thank you so much, Ray, to you and your team for the tremendous and collaborative leadership and working tirelessly to provide access to vaccines across islands and in addressing the healthcare situation. So mahalo to you and your team.
Next, as you know, we launched the bus several months ago, and I finally found out what I'm officially allowed to call them, but we're launching next week 2 more mini buses, which are just a little bit smaller than the big bus, but they have the ability to get out and provide great service to the community. So be on the lookout for those.
And where can they find out where these mini buses are going to be?
They're on our website. You can find out where they're going to be, what communities, what schools they're going to be in, as well as you can find the times and locations that we're doing vaccinations in our clinics and in our medical centers.
Great, thanks, Ray. Okay, so up next we have Jeff Harris, director of the Torkildson firm. He has over 40 years of experience, but obviously he doesn't look like he practiced for that long. And John Knorek, also a director and a counsel to many large and small employers in all aspects of employment and wrongful discharge law. John is actually a founding member and co-editor of the Hawaii Chamber of Commerce's Desk Manual for Employers and its Model Employer Handbook. So Jeff and John, I'm turning it over to you.
Thank you, Sherry. I will make 3 points, and then John will follow up with some discussion. My 3 points are really in the form of recommendations, 2 to the government and 1 to private employers. My first point is for the city and county. My recommendation is that they immediately move to dismiss that lawsuit by the 1,200 first responders. It's directly against applicable United States Supreme Court precedent. And that United States Supreme Court precedent was decided in 1905, but it's been cited over and over again since then on different reasons. In that case, the United States Supreme Court upheld the law requiring all Massachusetts adult citizens to get the smallpox vaccine. The Supreme Court explained that the government had a legitimate interest in protecting the health and safety of its citizens. The city and county that just had the first responders sue them has an even stronger case than Massachusetts did. First of all, the Massachusetts law that the Supreme Court upheld was a criminal law. It imposed criminal penalties. And second of all, unlike the Massachusetts law, the state allows the employees, as Ray explained his institution does, to pay for their own. Well, the state can have the employees pay for their own tests, unlike private employers. The complaint gives no reason for disregarding that applicable United States Supreme Court precedent that's been applied as recently as August 2 by a noted jurist out of the 7th Circuit Court of Appeals to uphold the Indiana University's requirement that all students get vaccinated. The complaint gives no reason for disregarding that applicable precedent. And for that reason, if I was handling the case, I'd recommend the city and county also seek sanctions against the first responder attorneys. Second point is also for the city and county and the state. As Ray mentioned, I think the best answer is for the government to mandate vaccinations. I recommend they mandate vaccinations for entrance into all locations which contain at any time, say 20 or more persons, or even less who elect coverage. The Supreme Court precedent that I just cited, the Jacobson case at paragraph 4 of the memo we distributed, supports that, strongly supports that action, as well as the motion to dismiss. And the significant point that the second recommendation does, where the government mandates the vaccination, is that it avoids private business taking over the contentious public health issue into their own hands. Now, the third point is for private employers if our government leaders don't satisfy their recommended responsibilities. And they're recommended because the United States Supreme Court said a century ago that they could do what I'm asking them to do. If they don't do that, my recommendation, and there's some disagreement between me and other attorneys on this, is that you mandate vaccination for all employees and customers and others who enter. The FDA, the CDC, the Department of Justice, EEOC, and the State Department of Health all approve and recommend vaccines. The EEOC and the State Department of Health, the Department of Justice and the EEOC both also express no opposition to termination of employees who refuse the mandate unless there's a legitimate, documented disability or religious reason that can be accommodated. And as John will explain, the accommodation we recommend isn't the testing. Isn't the testing protocol that the state uses for 2 reasons. As Ray mentioned, in the private sector, the employer has to pay for those tests. But in addition, a test once a week is about 14% effective as a vaccine. You're only getting coverage for 1 day. How about the other 6 days? My partner, John, will talk some more about that. And the only point that I'd make is the final point I'd make is I want to commend Ray's company. I want to commend Peter Merriman's company for being out in front of the private employers who they're mandating these vaccines for their employees, and soon, I believe, their customers, at least on the restaurant front, if the government doesn't get involved, to protect as Ray said, to protect their employees, their customers, and anyone else they come in contact with. I yield to John on the remaining comments.
Thanks, Jeff, and thanks, Sherry, for having us on today. I think my section is going to discuss what do you do with people that object to being vaccinated. So if a business makes the decision that for the health of their employees and customers, as well as the community at large, they're going to mandate that all employees get vaccinated. And a particular employee says, I don't want to be vaccinated. What can you do? There are really only two legitimate exceptions to being vaccinated, and the standard that applies to those exceptions is different for each. So under federal and state discrimination law, individuals with a disability that limits or prevents them from being vaccinated because it's a threat to their own health have a right to reasonable accommodation to continue working without being vaccinated if that does not create an undue burden on the employer. And under disability law, undue burden means some substantial expense or difficulty. What that really means in the workplace depends upon the structure of your workplace, how many employees you have, how that employee's job works. And so you have to do an individualized assessment for every employee that asserts a disability as a reason for not being vaccinated. You can get documentation from the employee to verify that need or that inability to be vaccinated. And then it requires what they call an interactive process of talking to that employee and exploring options that might enable that employee to continue working. As Jeff and Ray mentioned, there's a question about whether testing could be a reasonable accommodation because it is certainly not nearly as effective as being vaccinated. And the accommodation has to enable that employee to do their job safely. The reason employers can mandate vaccinations under disability law, in part, is because we have a pandemic and there is a direct threat to the safety and health of other people when an employee comes to work. Remember, just as a backup, you cannot require people to be tested or vaccinated if they are working remotely. The reason we can do the testing and vaccination is because they come in contact with other people. And so only those employees that are coming to the workplace can you impose either a vaccine mandate or testing. So we look at disability first and say, okay, what's the disability? How does it impact your ability to not be vaccinated? Can we accommodate that in some way? If you don't believe testing is a valid accommodation and still presents too much of a risk to coworkers or the public by having that employee work, can I structure your job in a way that eliminates or reduces the threat to others sufficiently so it's not a danger? What would that mean? The EEOC guidance on COVID talks about how you control the workplace, plexiglass shields, one-way aisles, different schedules, isolated work situations. Not every job can accommodate these things. So if there is no reasonable accommodation that enables an employee to do their job safely, you have a choice. Put the employee on leave indefinitely or termination. And both would be allowable. The final accommodation, however, would be a transfer to a position that might accommodate that person's disability. The second area is religion. And many people might have a religious objection to being vaccinated. Statistically, it's going to be a very small pool, but the difficulty is religion is very broadly defined under state and federal law. Any belief that takes the place of a traditional religion in a person's life is considered religion. It doesn't have to be an established church or religion. It can be an individual's belief system is as a spiritual or religious belief. So I don't believe that I can put any foreign object into my body. Okay, that may be a religion, and we have to respect that. However, the courts have said, unlike disability law, which requires you to accommodate somebody unless it creates an undue burden, meaning a substantial difficulty or expense, religion does not require as great of an accommodation as a disability. Any accommodation that is more than a de minimis or minimal burden or expense does not have to be taken. In the context of COVID vaccines, looking at testing as an option for a religious objector, I don't think testing is a reasonable accommodation, because the cost, the indefinite cost of weekly testing, is probably more than a de minimis burden. On the other hand, for a disability, depending on the nature of the job, it might be. But again, it's certainly not as effective as a vaccine, and that could be part of the argument. We also are in the area of pregnancy discrimination. Many women who are pregnant or want to get pregnant are fearful of getting vaccinated. CDC has made it clear it's not a danger. It's recommended for pregnant women to get vaccinated because the conditions are worse for them if they get it. But I think an individual who asserts a reason not to be vaccinated as their pregnancy or their reproductive health decisions, you can probably require that person to provide a doctor's a note that says that they should not get vaccinated. And again, we go into the interactive process of identifying a reasonable accommodation for that individual. Each of these discussions need to be documented and kept on record in a confidential file. So state and federal law requires we document the interactive process and show what did we come up with, how did we arrive at a decision either to accommodate or that we could not reasonably accommodate, and what are the consequences. So that's basically the law. One final thing is, well, let's say you get through this process and decide there is no accommodation and we have to terminate you because you're not able to be vaccinated and we can't accommodate you to do your job or transfer you to a job you can do. Would the individual employee be eligible for unemployment benefits then? The argument would be no. Number one, getting vaccinated, you can argue, is a standard that every employer has a right to expect employees to agree to, or it's insubordination. You have a legitimate work rule that says all employees must be vaccinated. I refuse to be vaccinated. You get terminated. It's non-compensable. On the other hand, if it's at the end of a religious or disability interactive process, there might be an avenue for an employee to get benefits. With that said, I think I've covered what I wanted to cover. Jeff, do you have anything to add to that?
John, I think we should mention that those employers that have a collective bargaining relationship would, of course, have to bargain about this a mandate with the union.
Yeah, agreed, except for new hires.
Yes.
Even if you're in a bargaining situation, you can mandate that all new hires be vaccinated without bargaining. Thank you.
Thank you, Jeff and John. Okay, we're going to go straight into Q&A because there's quite a number of questions that were listed. So I'm going to go to the first one. And we've been hearing this a lot here at the Chamber as well, that employers are required to pay for the tests. In fact, there's a statute, HRS 388-6, that bars private sector employers from requiring employees or prospective employees to pay for required medical or physical examinations or expenses. Will this prevent employers from asking unvaccinated to pay for their own testing?
Jeff, you want to take that?
Yes.
Yep.
Yes. And the statute will provide double wage damages and attorney's fees. And the Department of Labor and Industrial Relations will enforce that statute.
One side note is the reason the state can do it is because the state and federal government are specifically accepted or exempted from that statute.
thank you. Next question, I believe this will be for Ray. We are considering testing our employees that don't want to get the vaccination. What is the logic behind why weekly testing will be adequate from a safety reason?
Well, I think that point was already discussed. I mean, it's not necessarily the same as being vaccinated. Unless you're testing people on a daily basis or a much more frequent than weekly basis, it's not a adequate replacement for vaccination. And so I think the testing protocols have to be well thought out about what kind of work that people are doing, and what frequency the testing would be required to make sure that it's having the greatest impact possible, understanding that it's still not as effective as a vaccination. So that's going to be for, I think, individual organizations to decide how frequently to provide a reasonable layer of protection in terms of their testing protocol.
Thank you. And I believe the next question is again yours. We would consider following the vaccination mandate, but can you talk about the probability of getting tests in the long run and how we will be able not to tax our employees with the cost of testing?
Well, I think right now, as we said, the employers are required to pay for the testing if they institute such a policy. So that answers the taxing the employees. Right now, I think that we don't have real issues with testing capacity. We have the ability to provide testing, and I think employers can choose whether they're looking for PCR testing and or antigen type testing. And so I'd be happy to have conversations with folks who are looking for testing alternatives as they go about thinking about their policies.
Okay, another one for you. Is knowing that the vaccine is not yet FDA approved a valid reason for declining to vaccinate? Is that considered a medical reason?
Well, I don't think it's technically considered a medical reason. I think it's a reason that some people feel that they're not ready to take the vaccine. Frankly, I think that the number of people that we've already vaccinated under the emergency use authorization is more voluminous than any clinical trial that we could have otherwise expected. And so I think, while it's a technical issue that it has not yet been approved by the FDA in its full nature, I think I don't think it's a reasonable excuse. Now, the other thing is that we would anticipate that the FDA is going to be granting full authorization here within the next couple of weeks.
Can I add something there, please?
Sure.
And that is that the U.S. Department of Justice specifically rejected that argument in a rather long memorandum explaining that just because you can refuse the emergency use authorization under the statute, an emergency use authorization vaccine under the statute, that does not mean that an employer or another institution cannot take adverse action against you. So that argument has been thoroughly examined and rejected by the U.S. Department of Justice.
I think just to echo Jeff's point, as he said in his earlier presentation, the EEOC, and the CDC and the U.S. Justice Department all agree that you can terminate an employee who doesn't have a medical disability or religious objection that can be accommodated from employment for refusing to take the vaccine. So I don't think there's any legal barriers to mandating the vaccine and terminating employees who refuse to take it for a non-protected reason. And simply because the vaccine is approved through the emergency use authorization provisions of the FDA is not a valid excuse now.
I like Ray's answer better, that it's going to get approved pretty soon anyway.
Yeah.
Yeah.
Next question. This is a legal one. Employer offers a defined weekly testing for those employees who do not want to be vaccinated, and employee refuses or does not initiate required testing. What is the recourse for employer? Warning to employee, progressive discipline, suspension, or discharge?
But Jeff, I'll start with this. First of all, what is the reason they're refusing testing? So vaccinations and testing have the same limitations. If I can't be tested because of a disability, or I can't engage in weekly testing because of my religious beliefs, we still have to engage in the interactive process of identifying a reasonable accommodation. But if it's simply because I'm not really comfortable with the vaccine yet, or I don't really want to take it, I feel I'm strong and healthy enough and immune enough that I'll deal with it myself. It's my personal freedom. Then yeah, you can, I would suggest you warn the employee that if they refuse to take this option of weekly testing, their employment is subject to termination. Some of my clients have thought about just putting people on indefinite leave, hoping that maybe the pandemic will get to herd immunity, or there'll be some change in that will allow them to call them back later. Because we're so tight of a job market right now and unable to find, people to do all the work that needs to be done. They're hesitant to immediately fire people. But I think first a warning that if they don't, they will be terminated or could be terminated. And then you make a decision whether just to put them out on leave indefinitely or to terminate. Jeff, you want to add to that?
I just have one addition, and that's either on a vaccine, on the 2 vaccines or on the weekly tests. I recommend that the time the employee takes to have those tests or have that vaccine is compensated. I consider it a work hours.
Yeah, and maybe to add to that, until September 30th, employers can get a reimbursable tax credit for what they pay employees to take time off to get vaccinated.
Yep.
And just recently, as of July 29th, the IRS said, and to take time off to have somebody in their family go get vaccinated. Yep. So there's a really an incentive until September 30th for businesses to take advantage of that reimbursable tax credit to get their employees vaccinated and pay and cover that expense of them taking the time to get vaccinated, which would be required under state and federal wage and hour law.
Okay, next question. Where are we able to get a statement on how to define what are allowable medical and religious exemptions? Also, what other exemptions could we expect by our employees?
Go ahead, John.
Well, I think there's a number of different forms. We've developed one. There's a number online. I mean, basically, you need to document what did the employee say was the reason they did not want to get tested. Then you have to make an assessment as number one, whether the employee's explanation is believable. Okay. The EEOC says when I assert a religious objection, employers should just assume it's a credible religious belief. Now, if there are facts that you know of that would undermine your confidence that the employee's assertion of a religious belief is not real, that they're making this up, and just to avoid getting vaccinated, you can go further and ask some questions or ask some details about how their belief structure prevents them from being vaccinated. And maybe if they assert it's a established church, you can probably check with somebody within that religion as to their precepts that prevent them from being vaccinated. But that's not encouraged. It's generally advised that you pretty much just accept the employee's assertion of a religious belief. But you document that in a form, and you have your own making, or you can pull one offline, or you can call your employment attorney. We have samples that people can take advantage of. So for religion, it's one thing. Disability is another. Same thing. You document what the employee's assertion is. You document what you talked about, whether you believe it's a disability. There's a process under Hawaii law to have the employee get their doctor to verify that they have a disability that prevents them from being vaccinated. You document that. You document your discussion about reasonable accommodation and what alternatives you've discussed, and then you document what you've concluded. So for disability and religion, you can get a simple form or request for exemption and document that process. Other excuses, pregnancy, reproductive health decisions, I'm starting in vitro fertilization, I don't want to be vaccinated. again, you get a doctor's note and says, no, this employee shouldn't be vaccinated. Then you get engaged in the reasonable accommodation discussion. Jeff, I mean, I think there's some people that just have ethical and beliefs that prevent, say, I don't want to have a vaccine until it's fully approved. That's not a legitimate reason under law.
Going to the accommodation issue, it's going to also depend on the nature of business. I can't think of a reasonable accommodation other than indefinite leave that a restaurant is going to offer an employee who has a disability or who documents and explains a disability with a doctor's note or has a religious reason for not getting vaccinated. I just can't think of any accommodation that.
Yeah, I think maybe two of the hardest accommodation issues that we might face are employees that have a legitimate disability or religious objection and have teleworked, and now say, I want to continue to telework when the employer wants you to come back to work. Again, it depends on the nature of the job, whether that's even a feasible option. And the other is maybe daily temperature and symptom checks. I don't know. It hasn't been tested, in combination with a weekly COVID test. Who knows where it's going to go? But again, these are only accommodations for people with legitimate disabilities that prevent them from being vaccinated and legitimate, sincerely held religious beliefs. And so the problems come in if you open the door for everybody to be accommodated simply because they don't want to be vaccinated. We know we only have 60% of our population vaccinated. There's probably, I don't know what the number is, 10 to 20% of people that just never want to be vaccinated. I think Sherry, the chamber did some surveys, and we're looking at numbers. 10 to 20% of people just say they don't want to be vaccinated. Well, I hate to say it, but because there is no government mandate, the business community, if it wants to avoid being shut down again, has to take the lead. If we're going to hit herd immunity in the state, we're going to have to take steps that basically force our employees to consider getting vaccinated if they want to work.
That's why I don't commend the New York mayor for much, but he just implemented yesterday what we're asking our public officials to do. He just said, if you want to play in our town, if you want to go to a restaurant, if you want to go to a bar, if you want to go to another venue, you have to show that you had a vaccine. And that took a lot of the restaurants and other venues off the hook of dealing on a one-by-one basis with this contentious public health debate. And I commend him for that. I commend San Francisco for doing much the same thing, and a number of other municipalities. And I'd really like to see the mayor and the governor get behind that same sort of approach.
When you say we, this is your clients you're talking about that you're advocating for these policies.
Yes, not the chamber. The chamber isn't there. I understand that.
Okay. All right. For non-emergency medical and dental providers, can they require patients to show proof of vaccination or a recent negative test in order to receive services?
I've recommended that a couple physicians do exactly that. But Ray may have a point there.
Yeah, we haven't taken that path. We serve the broader community.
The providers who I've recommended to have gotten used to remote telehealth, and those are the sort of, if there's an alternative like that, they've explained that that's the alternative that they prefer to follow with unvaccinated patients.
I think it's important.
We're still doing nearly 40% of our ambulatory visits via some form of virtual care, mostly video.
Yeah.
Again, I think where the law intersects with that issue is in the public accommodation discrimination statute in my area. So the same principles that I discussed in employment would apply to providing services to the public. So if somebody isn't vaccinated because of a religious belief or a medical disability, we'd have an obligation as the provider of a service to reasonably accommodate that person to enjoy the benefits of the service. So you get into the same issue. So same principle in housing discrimination. So for condominium associations and people that have access or owners, use of common elements, have an obligation to accommodate disabilities and religious beliefs.
Next question, what about requiring a booster vaccine? The same rules apply as requiring the first vaccine?
Well, I don't think it's, I don't think that's a question we
Bill.
can answer yet because, frankly, they haven't authorized the broader community to have the booster. The only ones as of right now are those that are immune compromised. And now we anticipate that will change here. Like I said, maybe as early as today, at least with guidance related to that. And so, but until we have that guidance, that's not being contemplated.
What kind of proof for religion would an employee need to show if an employer mandates vaccines?
Very little. The EEOC defines religion very broadly. And again, as I said before, as long as the employee makes it clear this is a sincerely held religious belief against vaccinations, it doesn't have to be part of an established religion of any kind. But if you have facts to believe that this is not a true, sincerely held religious belief because of conduct that the employee engages in otherwise, or past behavior or other kind of information, then you can question it. But I have to caution most people to understand that the courts are very, and the agency, the EEOC and the Civil Rights Commission, are going to interpret religion extremely broadly.
But on the other hand, the defense or the next step is if the accommodation of someone that shows that they have a religious objection would impose more than a minimal burden or expense, you don't have to provide it.
And I think that's the balance there, because it's so easy to prove religion. The courts have defined the obligation of the employer to be very minimal in accommodating it.
I believe you answered the next question, but I'll restate it because in case some joined us later. If an employee refuses to get vaccination and they are terminated, are they eligible for unemployment benefits?
I think I answered that. And if you have an established policy that all employees have to be vaccinated, and he or she just refuses to be vaccinated because of their personal feelings about it, that would either be insubordination or conduct not in clearly not in the interest of the employer. That would disqualify them from unemployment benefits. If they lose their employment because there's no reasonable accommodation for a disability, then they're probably eligible because they can't work due to a health situation, not because of misconduct connected with work. Okay. Same might be true for religion.
Next question. It was mentioned that remote workers cannot be mandated to get a vaccine or tested. Under normal circumstances, my employees are on site supporting customers, but many have been working remotely due to the pandemic. Will it be okay to mandate vaccines for my workforce under these circumstances?
If the employees that are teleworking have to come onto the premises to meet with other employees at some times, more than likely, yes, unless they have a religious or a disability reason for objecting to the vaccine. But if they never come on, if they're 100% teleworking and they never have to come on to the premises with other employees, no, you cannot mandate vaccinations because there's no reasonable basis to do so. They're not coming into contact with other people or the public.
Next question. My company is currently at 84% fully vaccinated. This was completed by encouraging and incentivizing employees to get vaccinated. I have heard from several sources that around 70% will reach herd immunity. Why do I need to insist the remaining 16% of my employees have to be vaccinated if our company have reached herd immunity?
Ray, you want to do that, or should we just rely on the FDA and the CDC and all the agencies that say get vaccinated?
Yeah, they say get vaccinated, and people throw around the 70%, for herd immunity, but that's not a hard and fast rule, right? I mean, it's just when do we get it? When really what we're talking about is when do we get enough of the community vaccinated such that we can manage those who do get infected within the constraints of the existing systems of care and the community program. So. There's nothing magical about 70% and herd immunity, but again, the best and first line defense is get vaccinated.
And let me point out, oh, go ahead.
I'll give the business reason. You want to make sure that the rest of your employees are healthy. Those people that are unvaccinated are the pool where variants are going to develop. And the percentage of people that allow the virus to propagate and change are endangering the health of everybody else, even those vaccinated, and all the children that are unvaccinated in this community. So if a business wants to survive in this state and grow and protect the community, everybody should get vaccinated unless you have a legitimate medical reason not to, or religious belief that prevents you from being vaccinated.
And then paragraph 6, 7, and 8 of the memo that Sherry distributed explain the legal exposure that you have if you don't take all precautions to protect your workers or customers.
Sure, you're going to have workers' comp issues, right? If somebody gets it at work and they say, well, I got it from contact with a coworker, or tort claims, as Jeff's pointed out in a memo.
Next question. We're not able to require a COVID test if an employee is working remotely. If they were working remotely and returning to the office, are we able to require a test before they return or visit the office?
Yes. Anytime they come back to the office, you can mandate testing. And you can also, if they're only coming back for one day, I guess that's an accommodation. Okay, you need to get a test before you enter the office, and then you go back to teleworking. You might also require them to be fully vaccinated if they come back to the office, even for one day, unless they have a religious or a disability objection that you have to accommodate.
Are there exceptions to nonprofits who provide homeless shelters or emergency shelters for DV victims in requiring the clients to be vaccinated? There are some restrictions on family violence shelters prohibiting any DV victim from emergency shelter services if that shelter receives federal funding.
I haven't looked into whether there's a restriction on having those services limited to those who have been vaccinated. I would have to look into the specific federal statutes that apply. Jeff, do you have any thoughts on that?
I'm looking at that right now for a particular homeless shelter, and I don't have an answer.
Okay. Can you discuss the legal grounds for requiring customers, not employees, to be vaccinated to enter a premise?
Yes, I can, and I can cite the case that was decided by Justice Nakayama of our Hawaii Supreme Court about 20 years ago. It's the Gump v. Walmart stores case on paragraph 8 of the memo. Mrs. Gump was shopping in Walmart and she slipped on a French fry that a customer walked out of the attached McDonald's and dropped on the floor without McDonald's knowledge. And the Hawaii Supreme Court held that since it was in the mode of operation of McDonald's and the department store to allow people to walk out of the door and not knowing whether or not they'd drop a French fry, Mrs. Gump got a lot of money. And the Hawaii Supreme Court thereby established one of the broadest premises liability laws in the nation. If your mode of operation involves not knowing whether or not your employees have a vaccine or not knowing whether or not they've been tested, your mode of operation would be the basis for someone else who gets sick, either a customer, in the case of Mrs. Gump, or an employee who got sick from the interaction that led to COVID. The hard sell for a lot of plaintiffs' attorneys is going to be causation, but they're going to file a complaint and they're going to say, my employee got COVID because you allowed or my customer got COVID because you allowed unvaccinated employees to serve me. And maybe there'll be a causation issue that a jury will get to decide 2 or 3 years from now, but you're going to spend a lot of time and money because you didn't take the appropriate precaution to avoid that sort of claim. That's the Gump case.
Yeah, and I think you go back to the basic sign over the bar that says we reserve the right to refuse service to anybody, right? And so as a private business, landowner, operator, you have a right to decide who you let in to provide service to, except under public accommodation law, you can't discriminate against somebody because of race, sex, religion, disability, age, pregnancy, and all the rest. So if I want to check everybody for a vaccine before they come into my Walmart, I can do that and say, I'm sorry, you're not vaccinated. You can't show me proof of vaccination. You're not allowed in here. And that's what they're doing at all these other establishments in New York and San Francisco. And I've talked to a lot of vaccinated people that said, if a restaurant would do that, I would go there because I'm vaccinated. I'll feel safer going there if I know all the employees and all the other customers are vaccinated. So you can do that, except for a customer who says, I have a medical condition that prevents me from being vaccinated, or I have a religious objection to being vaccinated. And then you get into the, how do I accommodate, how do I provide that service to you? Okay, you can go online and order stuff from Walmart. We'll deliver it to you. Easy.
I was just in San Francisco and I had the vaccine card on my phone, and every bar that I went into a few. You just held up the vaccine card and they let you in. If you didn't have the vaccine card, they wouldn't let you in.
Can we require new hires to be vaccinated as well as part of our policy? And if they are not vaccinated, we won't consider them for employment until they get vaccinated.
Yes.
Yeah. Yes.
Can they ask that during the hiring process?
Yes.
Okay.
I would put, the way I would phrase it is saying your employment is subject to providing evidence that you are vaccinated. That's the way I'd set it up.
Because it would be considered a medical exam?
Because it's a medical inquiry under state law as to whether you're vaccinated. Now, there's an argument under state law that you can do that because it's necessary because we're in a pandemic. But I think the safer way to do it is just tell everybody, look, we'll hire you, but it's conditioned on you showing that you have been vaccinated.
Or if we hire you, we will require that.
Yes, yes.
Okay.
Some businesses, by the way, Sherry, are telling applicants that their employment is subject to getting vaccinated if they're hired. So if you're not currently vaccinated, you agree to get vaccinated within 7 days of hire, at least the first shot.
Okay. I'm in a condo complex. What about contractors who are hired by the HOA to work at the complex?
Same thing. I can refuse to engage you as an independent contractor unless you show me that everybody you send to my condominium is vaccinated.
Are there state or federal funds available for private employers to fund the testing?
I'm not aware of fund. Go ahead, Ray.
I would say not that I'm aware of.
Okay. Did you say that we'll be required to pay for the test if they submit an exemption? And do we, as an employer, need to pay for testing? I think you answered that, but just to restate it, just in case others joined us late.
Yeah, you have to pay for testing if you consider it as an accommodation to somebody who does not or cannot be vaccinated due to a religious or disability reason. Whether that is truly a reasonable accommodation is up to debate because of the ineffectiveness of testing as opposed to being vaccinated. But any testing done of employees are not, the state law prohibits an employer from making an employee cover any part of the cost of a test
In the private sector.
in the private sector. And again, the state and federal government are excluded from the payment of wages statute, HRS 388-6, subparagraph 6.
Many employees do not want to do invasive testing through the nose. Are there saliva tests that can be done?
Well, there are saliva tests that can be done. Whether the employer will accept that and pay for that is a whole different situation. I mean, the saliva tests that I know of that are part of certified, CLIA labs are mail-in, and so that there's a time element and there's a cost to that. I suspect if the employer like us is paying for the testing, they're going to set up a defined testing protocol with a defined testing provider.
There's also, Ray, the short swab tests. I don't know what those are, but in many healthcare facilities that are testing their employees every day, there's like a short stick and a little square that has a bar that appears in it if you're positive or not positive, and that takes like 15
most
minutes.
of the tests now are not the deep swabs like they were. I mean, if the testing that we do, it does not. I mean, it's still not going to be your favorite thing to do, but it's not the deep swabs like you were experiencing early on.
Is Hawaii Pacific Health and other businesses implementing mandates, paying for time off for these employees to get tested, or do they have to do it on their own time?
We're still working through that, but we'll either make it available on site so they can do it, during either before or after their shifts, I suspect.
The recommendation from the attorneys is if you're going to have them take time off working hours to get tested or vaccinated as a condition of employment, that's going to be compensable time.
Yeah, I suspect that's fair enough. And like I said, we're still working through the defined details, but we know it's going to be a cost to us.
Yeah.
John, if an employee has anxiety issues and is seeing a behavior specialist, is vaccinated, but due to exposure, does not want to get the COVID testing, can we do 10-day quarantine and get a medical certification from her doctor?
That's a little complex of a question. So if somebody has a certifiable medical anxiety disorder that is recognized by the DSM-5, and as a result of that anxiety disorder, a doctor will say they cannot perform their job function of job requirement of being tested because of their anxiety disorder. What accommodation do you have to engage in for that anxiety disorder that's a disability? Is that, am I understanding the question?
I will have this person contact you directly because since it's directed to you.
Okay.
Okay. Next question, and you briefly touched upon it, but again, we'll restate it. Can we ask an applicant if they are vaccinated prior to scheduling their interview if we are mandated vaccinations of all employees?
I do think you can. Like I said, I'd be more comfortable simply saying, as a condition of employment, you'll have to show that you've been vaccinated before you start work.
Agreed.
Okay. Is there any data on the spread of Delta by vaccinated employees versus unvaccinated employees?
There is data being gathered. I mean, what we do know is that whether it's employees or in any population, that vaccinated people do have the ability to be a carrier and spreader of the virus.
But Ray, can you also say that the unvaccinated people are much more likely to spread the virus?
I believe that's true for sure, and they're likely, and you're much less likely to contract the virus if you're vaccinated, and you're much more likely to have mild symptoms if in fact you do get infected.
What is the recommendation to deal with asymptomatic employees for the 90 days period from the positive results? Not
I don't really understand the question.
Yeah. Not sure. We'll skip that one. If the person who did post, I want to restate it, please send it this way. The next question for Ray. Is there an update on COVID test options and will it be evolving to some home or work self-tests accepted versus having to go to a testing center?
Well, we know that there are some home tests available, and there's, like we said, there's the nasal swabs, there's the saliva, but it's really going to be up to the employer in terms of how the bar is set in terms of what kind of test they're going to require. You know, whether it's from a CLIA certified lab, whether it's a PCR or an antigen test, and it's going to be up to the employer. But you know, for us, we're still going to stick to something that is a CLIA certified test.
How should employers respond to employees who ask if any adverse reactions would be covered under workers' comp?
I believe that is likely, that if I have an adverse reaction and I'm disabled as a result of a mandated vaccine, it probably would be work compensable. But again, in a normal situation, any ill effects from the vaccine are very temporary, and workers' comp won't kick in until after the third day. So, and employers are entitled to a tax credit for any time that an employee is unable to work because of the results of a vaccine. So until September 30th is the, be honest with you, if I were a business and I was contemplating mandating vaccines, I'd be doing it right now to get the tax credit because that expires September 30th unless Congress extends it, which I haven't heard of anything that they intend to do so.
Next question, you mentioned this, but if an unvaccinated employee infects a customer, could the employer be liable?
I think that's
Yes.
Okay.
If the customer could prove that, the key question for all plaintiffs' attorneys is causation. They can make the claim, and then they spend 2 or 3 years spending your time and money just trying to show that you caused it if you don't settle first.
As we are a small employer, less than 50 employees, is it reasonable to wait to FDA approval of the vaccine before requiring the vaccine?
I mean, the lawyers can answer it differently. I don't think there's any practical reason for that.
I don't think there's any legal reason.
Agreed.
With many of our businesses relying on visitors and many visitors coming from states without mask, vaccine, or distancing mandates, how can we avoid the optics of inequity between tourists and residents when it comes to mandated vaccines and other strong COVID measures for employees, but not for customers?
Require the same precautions of the customers. It's a difficult business decision. But you're really not protecting your employees or their families if you allow customers to come into your place of business without masks or without vaccines. It's a choice you're going to make. You're going to decide whether or not you're going to protect your employees, their families, and the community against the spread of the virus, or you're not.
And I think the data would also suggest that, you know, the tourists coming in, because they're either coming in with a vaccine passport or a test or quarantining, they're not really the issue that we're seeing with the spread right now. Mostly what we're seeing is community spread, and often it's related to, it starts with a resident returning from travel and then bringing it and spreading it through gatherings and the like, or to their family.
What is the liability to the employer for mandating the vaccine when employee suffers adverse effects from the required vaccine?
More than likely just workers' comp if the adverse effect lasts more than 3 days.
And And the workers' comp causation issue is very broad. So if there's an adverse effect that lasts long enough that's after a work required vaccination, that will likely result in work comp benefits.
And normally that is the exclusive remedy.
If an employee is unvaccinated, is social distancing and using masks, is that a reasonable accommodation to ensure safety of others, or is that not sufficient?
It depends on the nature of the business, the employee's job responsibilities, the structure of the operation, and how that person is situated vis-a-vis other employees or customers. So it's really a fact-specific kind of analysis as to whether that is a reasonable accommodation. I would say you would have to decide whether those steps, those standards, safety steps that are implemented for everybody are sufficient to prevent the spread of the Delta variant, which is what we're primarily concerned about. And from what I've read recently, cloth masks are not enough to stop the Delta variant. And Ray may have a comment about that. But I'm personally concerned that we are, what do they call it when there's a false sense of security with the people who are vaccinated going around unvaccinated people because they think we're vaccinated, so we're not going to get it. But the Delta variant is so contagious that simple precautions may not be enough. But I'd have to defer to some of the healthcare experts to discuss whether what steps should be taken. And again, it depends on the specifics of the work situation and customer contact and the rest.
First line of defense is for people to get vaccinated. I work in a workspace in the floor of my building where all of us are vaccinated. And when we're outside of our personal office space, we all still wear masks. And so anything short of getting vaccinated is just providing small layers of added protection.
Okay, we have time for a couple more questions, but there's still so many other questions that will be unanswered. So what we'll do is send them to our speakers and have them provide answers and email them to the attendees. So the next question, if company requires employees to get the vaccine, is it a good idea to get a copy of the vaccine card or just viewing it and documenting that employees show their card?
Well, I'll just say that if you do copy it, you have to preserve it under disability law for a certain length of time. And if it's an employee, it has to be kept in a separate file with medical information, not their regular personnel file. So there is a burden of record keeping that comes along with copying such documents.
Yes, but copy it.
And next question, can employers restrict employees that are not vaccinated from participating in certain activities, such as eating lunchroom with others, access to certain areas within the workplace, etc.?
Yes,
Sure.
Unless the reason they're not vaccinated is a disability or religious objection, and then you have to figure out how to reasonably accommodate them to enjoy the same benefit of employment that vaccinated employees have. So you might set aside, okay, 12 to 1 is for vaccinated people and 1:30 to 2 o'clock is for unvaccinated people for lunch. I don't know. I agree you can distinguish between vaccinated and unvaccinated people, but in access to common benefits of employment, but you have to be careful to ensure that those that have a legitimate reason for not being vaccinated are accommodated to enjoy that benefit in some reasonable way.
If an employee has an exemption and is put on leave for not getting vaccinated, does the employer have to keep the employee's name confidential?
Yes.
All righty. I think That's about it. We're 1 minute over time, so apologize for that. Again, to restate, we will have your questions answered by our panelists. I'll email them to you. And what we'll also do, some have asked for some template about language, we can provide those to you as well. Again, thank you to all of our speakers today for providing some critical information. As you can see, there are a lot of questions, so it's top of mind for many of us. The top line is that increasing our vaccination rate is a critical part in our economic recovery efforts, but also obviously to protect the health and safety of our employees, clients, customers, and our families. So as much as possible, get your vaccination, get your vaccines, and as Hawaii Pacific Health is offering those as well, and as Ray mentioned earlier, go to the website where you can find out where they can get vaccinated. So Ray, one last question. If a business wanted to bring the vaccine to the buses to their location, do you or other health providers, are they offering that?
Yeah, we just got to get it scheduled. As you can imagine, there's a lot of demand, but we are taking the bus out upon request to different locations to include the employer groups.
Great. Thank you. Thanks, everyone. Again, stay safe and healthy out there, and get your vaccines. Mahalo.
It's free.
Right.
Bye-bye.